Torres, and I'm going to start my presentation talking about a very common topic in recent days, that is craneocephalic traumatism. Okay, first of all, we need to understand perfectly what is craneocephalic traumatism. This is a medical term, but it is the same as a head trauma. Well, a head trauma is any injury that causes a special damage. It can be in the scalp, the skull, or the brain. And when we have a craneocephalic traumatism, we can have it in two different types. We can have it in a closed way and in an open way. For example, in an open way is when we have an injury in the head and we can see the blood coming out of the head. And when we have a closed injury, is because when we have a mass of blood inside of the head, but we cannot see the blood coming out of the head because the skin is not damaged. So this is going to provoke that the blood is going to accumulate inside of the head and can cause a lot of damages. Well, head traumatism can be caused with a lot of circumstances. It can be by a punch or a kick or fall down from, for example, a bicycle. It is really common. For example, in this image, we can see a tomography of the head of the patient. We can see perfectly that because of the skin is not perfored, we can see a mass of blood accumulated inside of the brain. So this mass of blood is going to cause a lot of pressure and can injure and damage all the tissues that are around of the mass of blood. So in this case, we need to get out all the blood of the head, so the blood is not going to cause a lot of damage later. Well, in medicine, we study a special structure of the head and in the brain that is called the Willis polygon. This structure is located in the base of the brain, on the bottom, and this structure is going to have a lot of branches that are going to irrigate different parts of the brain. So when we have a traumatism, it is very probable that one of those arteries are going to be blocked or can be broken. So if we broke any artery of the brain, this is going to produce that the blood is going to come out, and it's going to cause a lot of damages to the brain. For example, also, if we, for example, block this artery, this part of the brain is not going to receive the blood necessary to make their special activities, and this part of the brain is going to suffer a lot of damages, and it's going to be a dysfunctional area of the brain. So it is really important to know what are we going to do. Another topic, the Glasgow scale. This is a very common exam, and it's the principal exam that is realized in the hospitals, and it's the first attention given to a patient that is inconscient or that it has received previously a trauma. The Glasgow scale is a special exam that evaluates different areas of the patient. It evaluates the motor one, the visual, and the speaking area of the patient. For example, in the motor area, well, in each area there are certain activities that the doctor asks the patient to do, and according to the patient, if the patient can do all those activities, well, the patient is going to receive a special grade for this exam. For example, if we suppose that a patient has received a trauma, but it received a special trauma, and the patient is capable or it is able to follow the orders. For example, the patient is going to be graded with a number 6 for grading in the motor section, and there are a lot of different activities. For example, If he localizes the pain, for example, if the patient tells you, well, here is exactly when I feel pain, okay, but he cannot follow all the orders well, the patient is going to have a 5. And in a time that the patient cannot make any movement, I mean, it is inconscient, it's going to have a grade of number 1. Okay, another area that is evaluated is the verbal one, and it's the same. Each activity has a special grade that the patient is going to receive. This area of the Glasgow scale evaluates the ability to speak by the patient. And the third area is a visual one. According to the eyes, we can see special reflex in the eye of the patient that is going to make us as doctors to know the quantity of the measure exactly of the damage produced. The lowest score that a patient can receive is number 3. I mean, receive a grade of 1 in the visual area, the motor area, and the visual, motor, and speaking area. When a patient has a grade of 3, it means that probably the patient is in coma, and his danger is really high, and needs to be hospitalized immediately, because it is really important that the patient receive a lot of cares and all of that. The highest score is 15, receiving 6 scores in the motor area, 5 scores in the speaking area, and 4 scores in the visual area. When a patient receives a score of 14 or 15 in the Glasgow scale, it means that the patient is okay. It has a very hard kick in the head, but it is going to be okay, and the brain and his nervous system, it is normal, so it's going to be okay, that patient. But if we have a Glasgow scale about 6 to 13 points, it is, I mean, we can talk about a probable okay, the patient. This patient needs to be in observation at least 72 hours, only to be sure that the patient is going not to suffer later damages. But as I said before, if the patient has a Glasgow scale of 3 points, well, it's going to have a real heart traumatism, and that means that his nervous system is really damaged.
If he has what number?
A score of 3. Well, that's it. Any question?